Hello, my friends. As per your request, today we're going to discuss genital warts and all the information related to them. What are genital warts? Genital warts are a common type of viral infection caused by the human papillomavirus, HPV. HPV is one of the most common sexually transmitted viruses, with over 100 different types. However, types 6 and 11 are responsible for most cases of genital warts. Other types can lead to genital cancers, such as cervical cancer. You don't need to have sexual intercourse to contract a sexually transmitted disease. Skin-to-skin contact is enough to spread HPV, the viral family that causes genital warts. Some types cause warts and are generally harmless, but others may lead to cervical or anal cancer. Vaccines can protect against some of the most dangerous types. Symptoms and signs: warts usually appear as small, soft, pink or flesh-colored bumps in the genital or anal area. These warts can appear singly or in small clusters. The shape of the warts may be flat or raised and sometimes resemble cauliflower. Often, there are no symptoms and they can vary in size. Warts may appear on the penis, vagina, anus, mouth, or throat, depending on how the virus was transmitted. These warts are usually painless, but they may cause itching, burning, or discomfort. Some people may be infected with HPV and show no visible symptoms, but can still transmit the virus to others. Some may be infected with HPV without having any warts. Who is at risk of sexually transmitted diseases? Anyone who is sexually active, regardless of gender, social class, race, or sexual orientation, is at risk of contracting an STD. However, teenagers and young adults are more susceptible than older individuals. By age 25, half of sexually active adults will contract an STD. Having multiple sexual partners also increases this risk. Studies have shown that some STDs are on the rise among men who have sex with men, including syphilis and LGV. Transmission methods: sexual contact. Transmission primarily occurs through sexual contact, including vaginal, anal, or oral intercourse with an infected person. Skin-to-skin contact. Even without visible warts, HPV can be transmitted through close skin-to-skin contact. A doctor can usually diagnose the condition by examining the genital area and identifying warts. In some cases, the doctor may use molecular HPV tests to confirm the diagnosis, especially if the warts are not visible. Certain creams and solutions prescribed by a doctor can remove warts. Warts can be removed using cryotherapy, electrocautery, laser therapy, or surgery. Even after treatment, warts may reappear, so follow-up and regular checkups are important. Vaccines like Gardasil and Cervarix can be effective in preventing the types of HPV that cause genital warts and related cancers. Proper use of condoms can reduce the risk of HPV transmission and other sexually transmitted diseases, although condoms do not completely prevent HPV transmission. Knowing prevention methods and practicing safe sexual behaviors can reduce the risk of infection. Some types of HPV can cause cancer in various parts of the body, such as the cervix, anus, penis, mouth, and throat. Therefore, regular screenings and vaccinations are important. Infected individuals can transmit the virus to their sexual partners, even if no visible warts are present. Since HPV may persist in the body, long-term management includes controlling symptoms and preventing the transmission of the virus to others. Living with a sexually transmitted infection may cause psychological stress. Support from professionals and counseling can help manage these aspects. If you or your partner notice symptoms of genital warts or are at risk of HPV, consulting with a healthcare provider is crucial. Women should use Pap smear tests as part of their regular healthcare to detect any abnormal changes in cervical cells early. Yes, individuals with genital warts can be treated, but it's important to understand that available treatments can eliminate visible warts. Even after successful treatment, HPV may remain in the body and warts can reappear. Therefore, some individuals may need multiple treatment sessions. Currently, there is no definitive treatment to eliminate HPV from the body. The immune system of many people can control or eliminate the virus over time. In other words, in many cases, the body will naturally fight the virus and clear it. The immune system plays a crucial role in controlling HPV. In most cases, the immune system can clear the virus within several years. For individuals with genital warts or HPV, regular follow-ups and checkups by a doctor are very important. These checkups can help in the early detection of wart recurrence or any suspicious cellular changes. Counseling and psychological support may also be beneficial, especially in managing the stress and concerns related to this condition. In summary, genital warts are treatable, but the HPV virus may remain in the body. Disease management and regular follow-ups are key to controlling symptoms and preventing recurrence. This disease is a global health concern. Precise information on the number of people affected by this disease in various countries may vary due to differences in healthcare systems, reporting practices, and access to healthcare. However, some countries and regions may have higher prevalence rates. Contributing factors include population density, sexual practices, access to HPV vaccines, and public awareness about sexually transmitted diseases. Countries and regions with high HPV and genital warts prevalence. The U.S. is one of the countries with a high rate of HPV and related diseases, including genital warts. Many infections are due to the lack of HPV vaccination and risky sexual behaviors. In some Western European countries, including the UK and France, a high prevalence of HPV and genital warts has been reported. These countries have extensive vaccination programs to combat HPV, but cases still occur. In Africa and Southeast Asia, due to limited access to healthcare services and vaccines, the prevalence of HPV and genital warts is relatively high. Public awareness of sexually transmitted disease prevention is also lower. In some Latin American countries, HPV prevalence is also high, possibly due to limited access to vaccines and prevention programs. Factors influencing disease prevalence. In countries with widespread vaccination programs, such as Australia and some European countries, the prevalence of genital warts and other HPV-related issues has decreased. Countries and regions where risky sexual behaviors and frequent partner changes are more common typically have higher rates of HPV infections and genital warts. The level of public awareness about sexually transmitted diseases and condom use plays a significant role in reducing the prevalence of these diseases. Overall, the United States, some European countries, and regions in Africa and Southeast Asia may have the highest prevalence of genital warts due to differences in vaccine access, awareness levels, and healthcare services. Increasing public awareness, access to vaccination, and improving safe sexual behaviors are crucial in reducing the prevalence of this disease. Some additional important points to know about genital warts and HPV. Some types of HPV are more dangerous and may lead to cancers such as cervical cancer, anal cancer, penile cancer, and oral and throat cancers. Therefore, regular testing such as pap smears for women is essential. The HPV vaccine can prevent infections with certain types of this virus. In many countries, HPV testing is part of cervical cancer screening programs. This test can identify high-risk types of HPV and help prevent cancer. Pregnant women with genital warts may require special treatment. Warts may grow larger during pregnancy, and in rare cases, they can be transmitted to the baby. Having a sexually transmitted disease may cause stress and anxiety. Psychological support and counseling can be effective in helping manage emotions and improving mental health. People with HPV may be at higher risk of contracting other sexually transmitted diseases, such as HIV, which can increase the likelihood of other infections. Increasing public awareness about HPV, transmission methods, and the importance of vaccination and safe sexual practices can help reduce the prevalence of this disease. Even after successful treatment of warts, regular follow-ups and periodic medical checkups are necessary to prevent recurrence and detect any potential complications early. Individuals with HPV should learn how to live with the disease and prevent its transmission to others. This includes using condoms, limiting the number of sexual partners, and maintaining personal hygiene. Knowing these points can help you better manage this disease and protect yourself and others. If you have more questions or need additional information, I'd be happy to help. Let's take care of our health and that of our children. Thank you for watching this video. If you liked my channel, please subscribe and share it with your friends. Love you all. Goodbye.